The Flint Community Webinar, your community resource. We're here again today. Happy Black History Month, first of all. It is also National Black Women Physicians Day, so that's also very cool. Woohoo, yes. Thank you to all of our wonderful panelists. We've got a really great day for you today. We're going to be talking about the Student Symposium on Nursing, and Dr. Anar Guru, Dean of Health and Human Services from Mott Community College, and wonderful partner is here to help us talk about that. We're going to be talking about child and adolescent health, and our wonderful partner, Dr. Crystal Soderna, Associate Professor with the Charles Stewart Mott Department of Public Health, is here to talk a little bit about that, along with Tracy Payton Lester, who's the Program Director for Ellie's Place and Greater Flint. And then Dr. G and Nurse T are also going to talk to us a little bit. So we've got wonderful people and wonderful expertise in the virtual room today. So good to talk to everyone. So we'll go ahead and get started. Yes. All right. So we got a little information, and if we could bring Dr. Guru forward.
Hi, everybody. Thank you so much for having me here today. I'm really excited to present about the Symposium in Nursing that we're hosting at Mott Community College in conjunction with the MiCHWA of Nursing. And so we're making a call out to anybody who is an MA student, a CNA student, phlebotomy maybe, or if you're an ADN or BSN student, or a graduate nursing student to join us. There is a link on the flyer that you see on the screen right now. That's the registration link, and we just asked that you tell us what school you might be affiliated with, or if you're one of our partner institutions and want to join, you can fill that link out as well and just let us know. The symposium is going to include lunch for everybody.
Oh, Dr. Guru, we can't hear you. I'm going to go ahead and I'm going to reiterate some of the things you said just because we couldn't hear you. So Dr. Guru mentioned that there's the Student Symposium on Nursing, and anyone interested in MA, CNA, phlebotomy, BSN, nursing should attend. And they're going to be discussing current topics in nursing related care. There'll be great roundtable sessions, I believe we talked about, and a recruitment fair, and representation from our hospital partners in the area. So I know Hurley and McLaren has sponsored lunch, you said. So lots of good representation. Was there anything else you wanted to highlight? And I'll try to repeat it for you.
No, I think you did a fabulous job. Thank you so much.
No worries. No worries. So there's a link below. Could we get the link in the chat? And then it's going to be at the Mott Community College Event Center. And I can speak to how much work Dr. Guru and their team has put in getting this event together, and so much thoughtfulness around the health careers that are needed and necessary in the Flint community. And so much of a focus on being thoughtful about the type of workforce we need, and being thoughtful about training people to enter these sort of careers. So that's really awesome. And then last fun fact, Dr. Guru is a Michigan fan, and I gave her one go blue when they won because we should celebrate the wins of the state, but go green.
That was awesome.
Thank you, Dr. Guru. All right. I think we are moving on to, yes. All right. Hello, Dr. Soderna, how are you? Thank you so much for being here to talk to us a little bit about child adolescent health. We really appreciate your expertise.
Happy to be here today, and hello. So I am here. Hi, Nurse T. It's always great to see you. It's great to see everyone here today and have reasons to reconnect with one another. We know connection is so important and such a huge buffer to the stresses of everyday life. So pleasure to see you all here. Yes, I am Dr. Crystal Soderna. I am a pediatric psychologist, and as Dr. Edwards Johnson said, an associate professor in the CS Mott Department of Public Health right here in downtown Flint. I am a mother of 2 children, one of whom has special health care needs. Both of my kids attend public schools in Genesee County. This is my home. And I've been here for 15 years practicing as a pediatric psychologist. So over my time here, I've had the pleasure of serving upwards of 4,000 families and youth, and really working to provide the resources needed to not just survive, but to thrive and to really be what you want to be in this world. So it's my pleasure to be here today to talk about child and adolescent mental health. A little bit that I would love to hear about you. Now, we don't have the official chat that we sometimes have in Zoom, but we do have the Q&A option. So if you're tuning in from a device that allows you to select the Q&A button from, it's usually the bottom of the Zoom screen. If you want to enter in there your preferred name today, also what brings you here, what you're hoping to learn, so that I can try to weave that in and include it. And if you happen to have any favorite mental health resources in Flint City in particular, but Genesee County even, I would love if folks would share those, because we are stronger together and there are always new resources that I'm trying to learn about and share. So please feel free to put those in the chat and we'll, in the Q&A, and we'll all kind of keep an eye on them. Okay, so let's get into the state of child and teen mental health. If you are working or raising or caregiving for or in and around working with youth at this point in time, what I'm about to show you is probably not going to surprise you. There is some really nice data that the Centers for Disease Control collects via survey of youth or parents of youth. And we're going to start with what they looked at across the state of Michigan and in Genesee County. So in the state of Michigan, excuse me, 14 out of every 100 Michigan kids ages 3 to 17 years old were reported to have been diagnosed with either anxiety or depression at some time in their life by a healthcare provider. That is a lot of youth that are struggling with anxiety and depression to a point that it's impacting their life. It's causing them to actually have a diagnosis and need official and formal treatment for that. And then looking at Genesee County specifically, the survey data that's been obtained suggests that 48 out of every 100, so almost half of Genesee County high school students reported that they were persistently sad or hopeless in the past year. That's just not okay. That's not okay. And you have to imagine the impact that has on one's ability to learn, to connect, to find joy and value. So these are just not numbers that we can let sit. We also like to think about health harming behaviors because they impact health and vitality. We don't just want to look at depression and anxiety. And so when we look at Genesee County numbers specifically, 83 out of every 100 high school students did not get 8 or more hours of sleep in an average school night. Now, I know we're an overproductive society, and I imagine half of you are like, well, I don't sleep 8 hours a night, and that's fine. But the adolescent brain needs that rest. It's growing, it's developing, it's working very, very hard. And in the absence of getting adequate sleep, in the presence of chronic sleep deprivation, concentration difficulties, focus, regulating our mood, navigating stressors and adversities becomes 10 times harder. So this is a big one. Sleep deprivation is a big one. The next one is 31 out of every 100 Genesee County high school students did not eat breakfast for 7 days straight. If your tank is on E, where is your fuel? How are you energized? How are you engaged? How are you listening? How are you focused? Our brains need fuel. Fuel is food. So that's an alarming concern, a statistic as well. And then lastly, 17 out of every 100 Genesee County high school students did not go to school because they felt unsafe at school or on their way to or from school. That's a lot of kids that are either not feeling safe getting there or not feeling safe in there. And school is supposed to be a universally safe space, right? So we've got some work to do. We have some work to do. And we are not the only ones in mental health recognizing this. We have huge organizations that are concerned with pediatric welfare and health, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, Children's Hospital Association declared a national emergency as it pertains to child and adolescent mental health. And you can see the quote that they stated here. This was back in 2021, right? And these numbers have only gotten bigger or higher since then. And then similarly, here, right here in Flint and Genesee County, the Genesee County Health Coalition does a survey every 2 years to say, what are the needs? What do we think as a community we need to prioritize? And they pull up the top 10. Mental health was ranked number 2, right? Second to poverty and addressing issues with that. Second most important factor for a healthy community, second top health concern over the next 3 years. So everyone is pretty universally acknowledging and recognizing This is somewhere we need to invest and put some energy. So you might be asking yourself, why is this happening? How did we get here? You may also recognize this is not a new problem, right? So when I came to Flint in 2009, this was alive and well and a huge problem already. It's only been progressively worsening. And it's not unique to Flint. It's not unique to Michigan. This is a national crisis that we are experiencing. Now, if you think about the kids in your life and what their day-to-day life looks like, you may have some theories about why it is mental health is getting worse. I'm going to show you a alphabetized list of some of the biological, psychological, and social and environmental factors that contribute to the mental health difficulties we're having today. It's a lot to read. The font is small. I apologize for that. And this may not even capture all of them, but these are the ones that most obviously come to mind. And I think this is an important slide, an important concepts to think about, because it's all too easy to blame one thing. Kids aren't trying. They're not saying when there's a problem. You know, it's the school, it's the parents, you know, just not giving enough, not trying hard enough. And what we really know is all of those are really oversimplified views of what's happening. We live in a stressful, chaotic, unpredictable world these days, where there's a lot of systemic factors that are restricting our human rights that ought to be universal. And that creates a tremendous amount of stress and injustice, right? A lack of sense of belongingness, exclusion. And those are certainly things that are going to increase risk for mental health difficulties, along with some of the other ones that are here. So this is kind of a public health approach of saying we need population-based solutions because we have a population problem here. Mental health difficulties are not unique to a singular factor or child, many, many factors affecting the entire population. So child mental health is a public health crisis. And for that reason, we really need to think about public health approaches to our solution. So I loved this picture. I can't take credit for it. I'm not an artist. I wish I could. It's glorious. I found this in a 2021 publication, and I think it does such a beautiful job of kind of giving that socio-ecological frame, meaning there's lots of different layers that contribute to mental health. And this slide, we're really focusing on health, vitality, resiliency. So what you see in the dirt on the ground are some of those risk factors and challenges to mental health, adversities, trauma, poverty, discrimination. And you see there are folks working on those and addressing them, and they need to, eliminating them, planting over them, digging them up. And then you have this lovely ramp that brings you up to the voice that you need to have, and the things that you need in order to get there. And once you get up that ramp, then everyone shares justice and everyone shares safety and everyone has inclusivity. And only when we have that foundation do we then all have a voice. Do we then all have access to psychologically safe spaces where we live and play and work, that we have places we can connect and feel included and involved, that we all have access to healthcare when we need it. It's just such a lovely way to think about mental health and what we need to be healthy. And it takes what is otherwise a laundry list and kind of organizes it into a way that we can really better digest and think about, and think about where to put our resources. So here in Genesee County, I like to think a little bit about like, so what do we do? Where can we go a little bit more concretely? So I think at the 1,000-foot aerial view, the big things that we want to start thinking about now is how do we meet the basic needs of all children and families? If you're hungry, if you're worried about your safety, if you don't have safe drinking water, how are we talking about our mood and our emotions? Sleep. Go to school. We need to make sure we are meeting the universal basic needs first. Then we need to think about expanding the mental health services that work, where kids and families can reach them. Sometimes that is healthcare. If you can get into your primary care doctor, that's wonderful. But that may not always be the case. It may need to be a community center. It may need to be in a spiritual support space or church. It may need to be in the schools where kids spend a huge amount of their time. Then when we're thinking about who needs to be the provider, I'm a doctoral level fellowship trained specialist in that. Does everyone need that level of expertise and training? Well, if we wait till kids are really, really suffering and have been for a long time, probably. But if we're identifying things early, we're catching them early, then the level of intervention and specialty needed, expertise needed to treat it is far, far less. And we can do so much more with so much fewer resources and prevent so many poor outcomes. And lastly, we need to change the way we think about mental health, right? It's still so stigmatized in our world. And media doesn't do a lot to help that. But we all need to get better at having a lexicon or a shared way to talk about mental health and mental health difficulties. We all need to lead by example in acknowledging that none of us are immune to mental health difficulties. And we need to have space for not just do we or do we not have mental illness. We need to think about what is mental health and vitality and resiliency and value-based living, and what does that look like, and what can impact health. So that's my 1,000-foot aerial view. If you're asking yourself, what can I do? Like today, now I've got like super concrete for you. So the first one, for the kids in your life, give unconditional love and support. One of the biggest buffers that we know from the research, and I know from my personal experience, is unconditional love of one person in your life is a huge buffer and mitigator of adversities and stress. Be that person. You don't have to like every choice. You don't have to agree with every choice. And for children, you won't. They don't have full brain development. They're going to have poor judgment sometimes, but you can still love them and still support them. Number 2, create safe spaces for sharing. Kids need to know there's a place they can go and they'll be heard non-judgmentally and openly and listened to. It's easier said than done. I am a parent of 2. I know sometimes I want to like knee-jerk reflexively be like, what? And fix it and jump in. Or judge. They just need someone who can listen. If that's not you, that's okay. Find the person who it is for the children in your life. Number 3, we have to lose the stigma and we have to grow our village. Sometimes pursuing mental health treatment is seen as a sign of weakness. It's seen as a sign of sharing deep secrets, family secrets that shouldn't be told. It's seen as failing. And we all have to work on changing that narrative, or we will continue to perpetuate multi-generational traumas and adversities and issues. Somebody has to be the first one to take that step and to demonstrate the difference that it makes, the shield it gives you, the armor it gives you, the tools it gives you, and then to thrive above and beyond just that survival piece. And then lastly, we need to take concern seriously. If you are seeing signs in the children around you that something's wrong, you're seeing sudden and significant changes in their mood or behavior and they last a couple weeks or more, you're finding notes or letters, or they're actually saying things like, I'm going to hurt myself, or I don't want to live, those all have to be taken seriously. We don't want to call their bluff and be wrong, right? We need to take them seriously and get them help. And there are places in Genesee County where we can get that help. So of course, all of this wonderful grand idea I have couldn't be carried out by one person. We are stronger together. We have to partner. We have to pool our resources. We have to know one another's strengths and leverage them and lean on each other. And that is when we're going to create a much stronger village and connected and resilient community. And that is all I have for you today.
Dr. Sederna, I always love listening to you. Thank you so much for giving us that expertise. There are a few questions that came up, and one, I want to give a shout out to Deborah Dukes, who was in the chat because you asked people to tell their names. And so she provides social work services to, I'm guessing, Flint Community School students. Deborah, tell me if I'm wrong about guessing the acronym, but I think that's right. And I wondered if there's anything specific to Flint Community Schools we should be thoughtful about in terms of resources and support that students should be looking for, or that we can give to Deborah.
Wonderful. Deborah, thank you for the question. And I do see your introduction, but I didn't see it. So thank you so much, Dr. Edwards-Johnson, for sharing the question. In the schools in Flint, that's a great question. I think number one, to the extent you can get yourself and staff training in trauma-informed care and just trauma-informed approaches to interacting with youth, that would be a gift to yourself, to your students, and creating safe trusting spaces where they're willing to talk and be open with you, that are more inclusive, where again, there's that sense of belonging. So trauma-informed approaches to care. And there's lots of different associations who have put forth various webinars and things. You could probably find them for free, and they'd still be great, credible resources to fit the needs and the training space that you may have. Another one would be to, let's see, it could be you, it could be the school nurse who's developing a network of community-based partnerships for the most high yield types of things that come up in the school setting. So you'd want to have your plan for what to do when there's a child who might be suicidal or homicidal. You'd want to have a great plan of what to do if a child's seeming depressed or anxious, but needs more than what the school can give. You may want to know what to do if you hear that there's, you know, maybe some really unsafe living circumstances or things happening, to support the entire family with how to address that while also keeping the child safe. But the more you have your go-to partners, and the more and stronger those partnerships are with the community, the easier it is to coordinate care and support kids in getting to the help that they need. Those are like the couple big things that come immediately to mind.
No, that makes so much sense. And as you talk about the trauma-informed care training, I think about some of our partners in the area who've done that work, like Genesee Health Systems has put on trainings just like this. And I see Heather Lynn has got it in the chat for anyone who's interested. So that's wonderful. And then you talked a little bit about safe spaces that in the school systems they can build. And when you talk about a safe space, I think I know intuitively what that means, but what does that mean for people who may not be in the know? What does that tend to look like?
Yeah. What a great question. So safe spaces are spaces where, irrespective of your cultural identity, you know, aspects that may be marginalized or disadvantaged or a source of privilege, you feel like you have a person and a physical space where you can speak freely and openly. And so that means that those of us who have the privilege, which as the adults, the school personnel, just by having the title social worker in the school, you have a tremendous amount of privilege. And already that's something that could be an obstacle to folks, students feeling safe with you. So being willing to sit down and make yourself smaller, thinking about what students call you, thinking about the setup of your office, and does it show, like if you look at the bookshelf
I
behind you,
was
does
just
it show?
looking at your books.
Can you tell them in peace? Things that create a space that say, you can be here. I can be here with you. And then being culturally humble, never making assumptions, asking, right? The only way to know somebody's lived experiences is to ask. Then suspending judgment and listening non-judgmentally, seeking to know and understand for the sake of empathizing and understanding and supporting, not for the sake of judging. And those are kind of the basic tenets of safety, psychological safety.
I super appreciate that expertise. The last question I have for you, you mentioned this idea of how we reduce stigma. And as you were talking about it, I was like, okay, what are the things I need to do so that I'm reducing stigma, both and not just in peds, but honestly, for the med students that we teach, for the people, my patients I see in the office, whether they're kids or adults. And I wonder if you had any last tips on how we can work to reduce stigma in the settings that we engage in.
Ooh, it's a big one. That's
I
a great
know.
question. These are such great questions. And I'm going to try to be really succinct because these are huge passion points for me to talk about. So I think some of the ways we can reduce stigma, it's got to be multi-pronged, multi-method, but really from the top down, we need to be comfortable with the narrative that challenges to our mental health are normal, expectable reactions in a lot of different situations. And what's more important is we have the courage to seek the supports we need when they happen, not if, to navigate them, to get through them, to have them be a bump in the road and not a stop sign or a cliff we fall off of. So that's one of the biggest things we can do. How that happens is talking about it, talking about how it's okay, validating it, legitimizing it. Sometimes, and it depends on your role and to what extent, self-disclosure and talking about your own challenges with your mental health that you've overcome, and how you did that can be a big piece of it. Having the people and the places that you would refer folks to for help be known, familiar, safe spaces, not strangers that are behind a veil and they have to take the leap behind the veil, not knowing what's behind it. You know, ideally, these are folks who feel like real people. Just like me sitting here talking right now is a great way for people who are listening to go, oh, okay, Dr. C is not so bad. I think I could see her and share my problems. That doesn't happen if you never see me. I never engage with you, never talk to you.
Yeah, Dr. C is more than not that bad. Dr. C is pretty phenomenal. Thank you so much for this wonderful expertise. I walked away with a few specific points. Talk about it, validate your feelings, realize they're legitimate, find and understand what your safe spaces are, sometimes self-disclose to others about the experiences that you've experienced. Really wonderful expertise, Dr. Saderno. We really appreciate you. Thank you so much.
Thank you for having me.
Tracy Peyton Lester, thank you so much for coming to talk to us a little bit about Ellie's Place, which is a lot of the things that Dr. C has suggested that we find for people. So thank you for giving us your time and your expertise to talk to us today about this.
Well, thank you for having me. I'm so happy to talk about Ellie's Place and the resource that we have in our community. So Ellie's Place is a bereavement center for children. We serve children ages 3 to 18. So a little bit about Ellie's Place history is that it was founded in 1991 by Betsy and Woody Stover following the death of Ellie. She was 18 months old when she died, and she had 3 siblings that were still grieving her loss, and they wanted to find some support. So they found a program called the Dougie Center and brought that model back to Michigan. So our mission is to make sure, our vision is to make sure that no child grieves alone. Our mission is community-based healing center dedicated to creating awareness and support for grieving children and teens. In Michigan, we have 4 centers: Capital Region, which is in Lansing, Ann Arbor, West Michigan, and Greater Flint and Genesee County. And we are the newest branch of the organization. We started providing services over here in Genesee County in 2015. And that was due to families from this area traveling to Lansing to get the support. And they recognized that our community has several children that could benefit from this program. So in 2015, we started in Beecher School District with some school groups. And what we found were that over half of the students in that school had experienced the death of someone significant in their life, and they really could benefit from the program. So we did several school groups there, and from that, we began our on-site program. And I talked about we serve children 3 to 18. Our program is a peer-to-peer support-based program model. All of the activities that we do are age appropriate. And then we also offer an adult group for those children, for those parents or guardians who are raising children that are grieving. And why is this so important? Because we know that 1 in 13 children in the state of Michigan have experienced a significant loss. And we're waiting on the new data to come out this year because we think that it's going to increase due to COVID deaths. And across the United States, we know that 1 in 20 children have experienced the death of someone significant in their life. And when you throw in the deaths of cousins, friends, that number grows dramatically. So we know that there are a lot of children out there that are hurting and need some support. And also, when children don't resolve their grief and don't get the support that they need, we know that they have other difficulties, such as sleeping difficulties, depression, anxiety, poor school performance, violence, and possibly alcohol abuse and self-harming behaviors that may carry on into adulthood. And so that's why we try really hard to support the children that come through our doors and also the community. And the ways that Ellie's Place help with the peer-to-peer support, we create a safe space. And I think Dr. C mentioned about the safe space. So everyone is welcome at our program. We try to provide an environment where children feel that safe to talk about any of their feelings, emotions, just a real space where they can connect with others. And one unique thing about Ellie's Place is that when the children come to our program, it's like no other peer group that they have because everyone at Ellie's Place has experienced a death. So their peers at school may not know what it feels like to have a mother or a father that have died. So at Ellie's Place, they get to see that they're not the only person that this has happened to, and they get to grow from that experience. They get to share feelings and emotions and learn different feelings and emotions. One of the things that I often talk about when I talk about feelings, when children normally come to Ellie's Place, they know only the basic feelings: happy, sad, mad, glad. There's other feelings and emotion they get to tap into and be able to point a finger to why they feel that way and what that emotion is. We normalize grief. Death happens. It happens to everyone. And here at Ellie's Place, we get to talk about it and we get to share what goes into those feelings and talk about what is their new normal life going to be without that person that was so prevalent in their life. We talk about coping skills. They get to hear maybe a coping skill that another person in their group does, and maybe they can try that coping skill. And they also get to share the memories of the person who died. The young person in this picture is holding a memory box, and all the children that come through Ellie's Place get to make a memory box. And this is a safe space that we tell them they can put all of their memories of their person. So what are the programs that we offer? We offer an on-site and a virtual program. Our on-site program meets weekly on a Tuesday, and our virtual program meets bi-weekly on Mondays. We have volunteer facilitators that go through extensive training to become facilitators, and they work with the children in group. We meet for 1 hour. Of that hour, 45 minutes of that time, the facilitators have an activity to help children go through their grief journey. And then 15 minutes of the time, the children get to play in the activity room and choose a non-directive play activity to help them address some of the issues that they want to address. Um, for our adult groups, we do have licensed clinicians that facilitate those groups. And right now we have a spouse partner loss group and another significant loss group. We also do Ellie's Group, which is a school-based program where we go out to schools in the community and provide the support in the schools. Right now, we offer middle and high school Ellie's Groups. We are working on an elementary curriculum that probably will be available in the fall of this year. We also do clinical consultations, and that's a support to families, community members, professionals, and referral assistants. So if someone has experienced a death and don't know where to turn, they can call us and we can help guide them. We have lists of different community providers that provide a specific service that they may benefit from. Also, families sometimes call us right after the death and get information on how to explain to their children about the death and what are some key words to say and how um, to expect their children to behave and how to make it more comfortable for the child to get that information. One of the proudest things I am able to say about Ellie's Place is that Ellie's Place is 100% free of charge. We know when a family experiences a death, sometimes there's a decrease in income because it may have been a parent that died, and now we're down to one household income. and things change. Insurances change. Some insurances don't cover mental health supports. So we have generous donors that give to us, and we're very grateful that we can offer this service 100% free of charge. And any families wanting to get the information, we're always available. Families get to start and stop the program. Our in-person groups and our virtual groups are open-ended, so we accept families at any time. Once they feel they've addressed all the needs that they have, they they can leave us, and if they want to come back, they're always welcome to come back. We always say, once you're Ellie's Place family, you're part of the family, so you can come and go as you please. And there's some ways that you can help. Please share the resource with bereaved families. We got to make sure we use it to keep it in our community. If anyone knows anyone that wants to volunteer or work with grieving children, you can find a volunteer application and opportunities on our website, and follow us on social media. We're on Facebook, Instagram, and LinkedIn. And this is our contact information.
Thank you so much. I have a few questions if I could. This was amazing.
Sure.
And you provide such a wonderful resource for the community. So thank you so much. It's also great that we now have one in Flint. It's so
Yes.
great that we're not having people travel to Lansing, because it feels like that can be such a barrier for people in terms of accessing resources, right? As you've got busy families who've recently gone through a really traumatic event, and just that added drive or that added sort of barrier feels like it can be hard for people. So it's really wonderful that you're now in Flint. I wondered if you talk us through the process. So say, someone has a friend, a colleague, a patient who they want to send to Ellie's Place. What does it look like to sort of from the start of them being connected with your resource and then going through the program that you kind of described in your slides?
Absolutely. So we encourage the family to call. They can call if they're with a provider that's referring them. Well, we do want the family to call.
Sure.
And because sometimes families aren't prepared, we want to talk to them and just see where they're at in their grief journey. So once a family calls, we talk to them, get some information from them. We explain the service, send out an enrollment form. Once they get the enrollment form, they complete that enrollment form and return it back to us. And one of our bereavement coordinators reaches out to the family once we get their paperwork back. And then we invite them in, the whole family, anyone that's going to attend. We want them to come in, get a tour of the center. For the children and teens, we show them the group rooms, the activities, talk about what the process is going to be like when they come to Ellie's Place, because on that first night, we don't want them to be shocked and not sure what they're walking into. So we give them a really good overview of what it's like to come to Ellie's Place. And once they complete that intake, they're ready to start. Like I said, they can start whenever they like and end whenever they like. We do a wonderful closing ceremony when our families end, but we do know that grief changes as children go through their developmental cycle. So a child that attended when they were 6 may be okay until they hit puberty. So they can come back once they start having additional difficulties.
I'm so glad you mentioned that age difference, because I wondered a little bit about how the services change, and you kind of alluded to it in some of your slides for, children who might be very young versus maybe your pre-adolescent children, or your young, your teenagers.
Yeah. So what we have is we have 5 different groups. So we have our preschool kindergarten group, our lower elementary group, our upper elementary group, middle school and high school group. So kids are broken down into their same age peer group when they
Right.
come to groups at Ellie's Place.
That is so phenomenal. I wonder how, for example, if you are noticing something that comes up for a kid, and you mentioned things like, grief may make it hard for children to sleep, or they may make it hard for children to maybe eat. Are there specific things that you do or referrals that you make when you kind of notice things that might not be going well for a particular kid?
Absolutely. So with our facilitators, we give them 24 hours of specific childhood grief training. So they're with the kids in their groups for a whole hour. So we do a briefing at the beginning of our program night with our volunteers, and then we do a debriefing at the end of program. And then we talk about maybe some things that they're noticing about the child in group. And then if there's something specific that we need to talk to the family about, we have our bereavement coordinators contact the families during the week, and then they process and talk through it just to make sure that that child is on the right course. And there's sometimes where we do have to make outside referrals, and they need maybe a little bit more than peer-to-peer support, and we direct and guide the family on getting that support for the kids in the program.
Oh, that's fantastic. And I see Dr. Sedurna wrote in the chat, and I wonder if you'll speak to this a little bit, Dr. C. Talk to us, what is the importance of kids being matched by peer group? Why is that so important?
Yes, at least by roughly their age for kids who are otherwise typically developing becomes important because kids are not mini adults. And Tracy will probably be nodding away to this too from what you
Yes.
see in your groups. At different ages, the things that matter, the way they're thinking about things, the way they will talk about things, even the types of activities that they would enjoy doing are going to differ. And even just again, that safety, if you have kids who are physically double your size in your group, that can be really intimidating. Or if you're the bigger one, you're like, why are these littles in here? They're not going to understand what's going on for me, right? Like that's the adolescent. They'll never understand. And so having different groups by age helps with that safety and sense of cohesion, and also making sure that the programming aligns with developmentally what they really want and need and what should be prioritized for that age.
That
Great.
feels like so much of what I learned in my child development stuff, right? Is that these kids, even the way they make friendships, the way they have conversations, the way they're likely to interact, it totally makes sense that, if you're a 5-year-old, that maybe working with the 8-year-olds isn't the best way to sort of work through some of the stuff you're thinking about. Tracy, I super appreciate all of your expertise and all the wonderful resources that Ellie's Place is providing to the Flint community. Wonderful, wonderful resource. Thank you so much for the work that you do. Can you do me a favor and show your slide again that shows how we can help? Because I just want to remind people how they can support the work that you're doing. And is there a way to donate? Like you said that sometimes you get donors. Is there a way that we can be donating to Ellie's Place if that's something we're interested in?
Absolutely. On our webpage, there is a donor form on there, and then also our wish list is on our webpage. So
You have
there's
a wish list?
Yes.
What are some of the, do you, off the top of your head, what are some of the things on the wish list?
We have several books on our wish list. I'm trying to think.
I love that you've
Right
got
now, I
this.
think there's markers, crayons.
That's so awesome. Even
Yeah,
just,
so there's a plethora of things on there. What we're running into, and I think they put them on there, is that we used to be able to do a potluck supper for our families before group, but since COVID, we haven't been able to incorporate that back into our program safely. But we do need snacks because our kids are coming to group hungry, and so we like to give them a snack.
yeah, that is just so wonderful. And I love that you've got a wish list that sort of can be for anyone's pocketbook, right? Like across
Mhm.
the spectrum.
Yes.
So I love that. Thank you so much for telling us how we can support, and thank you for your expertise.
Thanks for having me. I really appreciate it.
Awesome. All right, we've got our OGs, Nurse T, Dr. G, coming to talk to us a little bit today. Thank you so much.
Good afternoon, everybody. It's just so amazing to hear all of the education that had went forth, and how today, when we was going to talk about our subject of heart, how we focused on what impacts the heart as far as stress. So the mental health part of it. So that was just awesome. So our topic today is guard your heart. It determines the course of your life. Next slide. I am Tarnisa Martin, otherwise as known as Nurse T. I serve as the patient resource and community advocate for Hurley Medical Center, as well as the assistant director of public health nursing for Michigan United and founder of Empowered to Live Better. And I'll turn it over to Dr. G so she can introduce herself.
Hello, everyone. I'm Dr. Teresa Gordon, or Dr. G. I'm a service director of public health nursing, navigator for Michigan United, founders of Encampment Angels. Nice to meet everyone. It's a pleasure to be on the webinar. We'll turn over to Tanya.
Good afternoon, everyone. I am Tanya Battle. I am the Assistant Director of Public Health Nursing for Michigan United, and just recently school nurse for the Flint Cultural Center Academy. So I'm so excited. Thank you.
And as you'll see, our caption at the bottom is we are servant leaders. We pride ourselves on being servant leaders, meaning that we're focused on serving in the community from a space of passion. Nurses, authors, health literacy educators, speakers, and community advocates, taking our message to the streets for the betterment of our community. We all have experiences internal, working in a hospital and other organizations for years, but our passion is taking it to the streets. So next slide. So most of the information you will be familiar with. And one of the things that I thought it was important to see, because most of our work, we serve a lot of the Black and Brown community. How does heart disease impact our community? According to the U.S. Department of Health and Human Services, African Americans are 30% more likely to die from heart disease than non-Hispanic whites. African Americans may carry a gene that makes them more salt sensitive, increasing the risk of high blood pressure and heart disease. African Americans are disproportionately affected by obesity. So a lot of times when we share our conversations, and it's obvious that we are African Americans, it's a twofold, because we have to share the information knowing that we can be impacted by the same information that we're sharing. That's why we are so transparent. Next slide. The value of your heart. The one thing that we want to come across is, I know that, we have our heart, and everybody, sometimes we can take our heart for granted. I like to call our heart the queen, but also just making sure that we really emphasize and we really know that the heart is the most important organ in our body. It's the muscle at the center of your circulation system, pumping blood around your body as your heartbeat. The blood sends oxygen and nutrients to all parts of your body and carries away unwanted carbon dioxide and waste products. So one thing that's very important to hear, whoever's listening, wherever you at, just place your hand on your heart and know that you have to value your heart, because that's the most important organ in your body. Next slide. Pumping oxygenated blood to other parts of the body is one of the functions of the heart, circulating hormones and other essential substances to different parts of the body, receiving oxygen, poor blood, and pumping to the lungs for oxygenation, transporting waste products from the body. It controls the rhythm and speed of your heart. And one thing that's real significant, it maintains our blood pressure. Next slide. February is American Heart Month. And I want to encourage everybody to for this awareness and to take it personal. You have the power to take action to protect yourself against heart disease. Next slide. Risk for heart disease. common and a lot of us are familiar with them, but sometimes we think that they don't apply. Sometimes we be in denial. I can honestly say I have been in denial on several occasions. Overweight or obese, a smoker, high sodium diets, 2+ alcohol drinks per day, older or shall I say maturing, history of high blood pressure or diabetes, inactive, family history of heart disease, history of sleep apnea, chronic kidney disease, history of thyroid and adrenal disorders, and our main topic for today is stress. Today's focus is on stress. The impact of stress on health is a significant connection between social and physical environments. It directly influences biological processes, contributing to disease development and encourages and maladaptive health behaviors, posing risks to individuals. Although stress is unavoidable, implementing prevention and intervention strategies can mitigate its effects on health. Stress is the key to understanding many social determinants of health. Next slide. So I saw this because we often hear too blessed to be stressed. We often hear this a lot in the community. So I just want you to take a moment and look at this picture and ask yourself, are we really too blessed to be stressed? And you will see that the why is capitalized because I wanted us to focus on the you, to focus on your why. Are you really too blessed to be stressed? I'm sure this woman that's sitting there, she's in a high profile position. I mean, she's well dressed, but look at everything that's coming at her. She has so many things that's coming at her. And look, what's the first thing that she's doing? She has her hand up on her head and she's holding her head. And look, there are multiple thoughts that's coming from her. So at right now, she's at risk for a heart attack. If she has diabetes, I mean, her blood sugar could be lower or higher. If she has kidney disease, her blood pressure can increase. If she has any kind of thing, she could have chest pain, angina, because right now she's at a point of a break. Next slide. Okay, from a nursing perspective, I'm gonna turn this over to Doc G.
We as frontline leaders, nurses, healthcare providers, and community advocates, we have discovered that most of our patients, when they come into the emergency room or get hospitalized, the common theme for their experience is a level of stress. As we well know, some of us don't even realize when we're under stress until we go to a doctor and physician like, man, wow, no wonder my blood pressure's high. I'm not sleeping at night. I'm overthinking. And like as the previous slides talk about mental health, anxiety, depression, of those natures. So these are some of the things from a nursing perspective that leads to stress. And I'll turn over to Tanya for the next slide.
Stress can increase your risk for heart disease. So we all know that stress is a normal part of life. Stress can come from physical causes, not getting enough sleep, or having an illness. Stress can be emotional, like worrying and not having enough money, the death of a loved one, your children, your family. Stress can come from less dramatic causes like everyday obligations and pressures that make you feel like you're losing control. Next slide, please. Your body's response to stress is supposed to protect you, but if it's constant stress, it can harm you. The hormone cortisol is released in response to stress. Studies suggest that high levels of cortisol from long-term stress can increase your cholesterol, triglycerides, your blood sugar, and your blood pressure, which are all common risks for heart disease. This stress can also cause changes that promote the buildup of plaque deposits in your arteries. And even minor stress can trigger heart problems like poor blood flow to your heart muscle. And this is a condition in which your heart doesn't get enough blood or oxygen. And I will turn it back over to Nurse T. Next slide, please.
People who have a lot of stress may smoke, they may drink, they ignore signs and symptoms, not prioritize and follow up with primary care physicians. screenings or choose unhealthy ways to deal with stress. I can personally say retail therapy has been one of my ways. And then too, I've also realized that as healthcare providers, we are so busy taking care of others that we don't always seem to take the time to take care of ourselves. Recently, I went to the physician and found out that my blood pressure was high. And of course, I'm out here educating every single day. I know the signs and symptoms, I know the risk factors, I know the stages of hypertension. And when my blood pressure was 150/90, I looked at the doctor and said, "That's not my blood pressure. I only had that blood pressure because of things that's going on in my life." And he looked at me and said, "Really, Nurse T? Really?" So what I'm saying is that hypertension, it can impact anybody. Stress can level you up to a place to where, like Tanya just mentioned, that it can activate, diabetes, or it can activate kidney disease. But the one thing I want everybody to know is all is not lost. You can still bounce back, heal, and win. This is a title of one of my books that I wrote, but I thought that it was so profound because when we bring information, sometimes information can be disheartening and sometimes information can cause us to lose hope. But what I want to let you know is when we bring awareness, it gives you an opportunity to put things in perspective. It gives you an opportunity to realign your thoughts, your ways, your ideals, and your behaviors. And if you may be like a person like me that really don't like going to the gym, guess what? It would inspire you to go to the gym because now you know that is necessary. And so why we really want to emphasize this is while you have those opportunities, just take advantage of every opportunity in life that you have to become a better version of you. Next slide. Some self-care tips, which we've discussed: don't smoke or use tobacco. And I know that it's easy for us to say that, but if you are smoking and get help, and try to quit, do whatever you can. This is not a platform to belittle you because I understand the reason why people do smoke. Physical activity, at least 30 to 60 minutes a day. But if you can't do 30 to 60 minutes a day, commit to 10 minutes or maybe 15 minutes. The ideal is to start the process and put something in work. And that's the things that we've said: heart healthy diet, maintain a healthy weight, and the quality of sleep. I know Dr. Crystal mentioned about the children requiring 8 hours of sleep, but you think about it. The adults don't get that requirement either. And one thing that was so profound when I heard her talking about the children, so the children are having these issues early. So guess what it does? It travels with them when into adulthood. The other things are things that most everybody's familiar with: manage stress, regular health screenings, reduce your alcohol consumptions, cholesterol levels. And one key point, because I know we're coming to an end, is take medications as prescribed by your PCP. Please be compliant. Do not try to self-treat or stop your medications. If you are having side effects or any kind of complications, please follow up with your healthcare providers. I'm sure Dr. EJ would appreciate you coming to her and letting her know versus you coming to her and saying, "You know what, I just stopped taking these blood pressure meds. And now because you didn't manage your blood pressure, you are at greater risk for kidney disease." Next slide. Heart attack symptoms, which a lot of us know: chest pain, upper back, heartburn, extreme fatigue or dizziness, heart failure, shortness of breath, extreme fatigue, swelling of feet, ankle, legs. The key is making sure you do not ignore these signs and symptoms, that you be familiar with these signs and symptoms, and that you follow up. Next slides. Okay, so we're at the end. So now we can say we had a healthy, good time. Our resources were from American Heart Association. The pictures from the internet was to basically display a visual ideal, healthaffairs.org. The educators, Tarnisa, Dr. Gordon, and Nurse Tanya. And we so much appreciate everyone. And we so much want everyone to take their hearts in consideration. And for all the women on the line, the heart is the queen. So to say, I got to take care of the queen. So thank you so much. We appreciate all your time. Thank you.
We're gonna close it out with Nurse T. I can't end it better than this. Thanks, Nurse T. Thank you, Tanya. Thank you, Dr. G.
Thank you.